Oh, hi! I didn't see you there. I'm Curtis, and welcome to the Respiratory Therapy Department. Today I'd like to tell you a little bit about oxygen administration. Oh, you didn't hear me? Oxygen administration. Well, first of all, you're going to need your respiratory therapy program proficiency evaluation guide, which if you're anything like me, you'll have on you at all times. So why don't you go ahead and join me on page 13. Go ahead, I'll give you a few seconds. Great. Now let's get started. Now the first thing you're going to want to do is verify your orders. If you don't have any orders, just use fake orders like I have here. Go ahead. I'll give you a few seconds to do that. Now the first thing you're going to want to do is maintain some asepsis. Now if you're a woman, you can go to the women's room to do that. But since I'm a man, I'm going to go to the men's room. Now, I'm about to maintain some asepsis. I'm going to go ahead and do it in the men's room. Mainly because it's the only place that has a sink in this building. What you should do is do it outside the patient's room. Now you may not be able to follow along in my classroom, but please imagine yourself washing your hands as I wash mine. Try and really get the feeling of what it's like to really wash your hands. And observe and learn. It should take about 30 seconds. Yeah, that feels about right. Make sure to pat downward with a paper towel. Don't be afraid to use several. And now we're ready to work. So come on. After you wash your hands, the next thing you're going to want to do is apply some gloves like these. You can typically find them in any patient's room. Go ahead and adjust them until they feel good. Yeah, snug fit. All right, let's move on to the next step. Now the next step on our list is to identify yourself and identify your patient. Now what we have here is a make-believe patient, but don't let that fool you. You're going to be dealing with a lot of real patients in the real world. Now what you're going to want to do is introduce yourself first and foremost. Hi, I'm Curtis. I'm from the respiratory department and I'll be your RT today. You see how easy that was? Now, after you've introduced yourself, like I just did, you're going to want to check the patient's wristband to make sure he is who he says he is. Now, what we have here is an imaginary patient, and as you can see, he doesn't have any arms to have a wristband on. You're not going to run into this much in the real world. Most of your patients will have arms with wristbands. But for the sake of the video, let's pretend that he's got a wristband that I can check. May I check your wristband, sir? Thank you. No. Now, if you're keeping up in your manual, you're going to see that we're on step 4, and that's explaining your procedure to your patient, a very important step. So come on, follow along with me as we explain the procedure. Sir, I'm going to be administering some oxygen to you through a mask. It's going to ensure that your oxygen blood levels stay at an adequate level. Thanks. I bet you're glad you checked your orders. And if you didn't, that's okay. Just remember next time. But if you did check your orders, I'm sure you'll remember that we're supposed to be using this non-rebreather, coinciding with this oxygen tank. Using both of these in tandem will make sure that our patient is properly oxygenated. Come on, let's administer this oxygen. Next up, you're going to verify your proper function of your setup. Now here in this tank, you're going to want to verify that you have oxygen in here. An easy way to do that is to check this gauge on the flowometer. 1500. It's not full, but it'll do for our purposes. Hey guys, we're on step 7 now. That's where the action is. This is where you really get to interact with the patient. What we're going to want to do is apply our device to the patient. and really administer some oxygen. Yeah, that's tight. Make sure and ensure a snug fit. There we go, sir. And now, the most important part. We turn on our oxygen. We're on the second to last step now, rounding the bend. But a few things are left before we're done. First off, after applying your device to the patient, you're going to want to check his flowmeter and ensure that the proper amount of oxygen is being delivered. A good way to do this is also by pulse oximetry. Don't be afraid, the patients won't bite. Just like so. This might take a few seconds. Just as I thought. Perfect. Well, there you have it. That's oxygen administration. I hope you've had some fun and learned a few things. If you remember these steps, you will be successful in administering oxygen to any patient, fake or real. You all have a good day.